live with is at risk, increased risk for severe illness, which could result in hospitalization. So there are factors that are associated with increased risk of hospitalization with COVID-19, and the CDC has broken them down and kind of given them risk factors. So asthma as a comorbidity has a slight increased risk versus a generally healthy individual. Comorbidities of hypertension, obesity, and diabetes all have 3 times of risk. Severe obesity and two conditions have a 4.5 time risk of hospitalization if you were to have COVID. So you need to know what your own personal risk is, or the personal risk of your family members given these comorbidities. We also know that COVID has been an age-related for severe infection, and the CDC has also broken down that data using the people that are in their late teens and early 20s as the comparison group. And as you look out on the data, you will see that it starts to increase. Increase is highest for those individuals that are over 85 years of age. And most of those that have been sick or have died in that age group have been associated with nursing homes where they're living in congregate settings and have more, in large group homes. The reason that age is related is we tend to add and increase our comorbidities as we age, and so that's why there is that direct correlation between age and comorbidities with this particular disease. Next, you need to consider which mode of travel you're going to take. So each one has its different risk associated with it. Now, air travel, your risk is really at the terminal, where you can be in close contact with many people that may be waiting in security lines or waiting in waiting areas. Now, I personally have not flown since the pandemic, but I know that the airports are using social distancing and trying to provide space within the terminals. Once you're on the airplane, the airflow on airplanes has long been engineered to circulate and be filtered so that most viruses do not spread easily on airplanes. And so that has been historic practice for that most respiratory viruses do not spread easily on airplanes. And then finally, you need to take into account whether or not how are you getting to the airport and to and from the airport. So taxi and rideshare can present some risk. So being with a driver, if you do need to take a taxi or a rideshare, you would wear a mask, and then you would roll down the windows for increased ventilation. Preferable if you could have a family member or somebody that you know to pick you up would be the ideal. Now, car travel has associated risk as well, because you would have to make stops for food, gas, and bathroom breaks when you're car traveling, and that just puts you in contact with other people and frequently touch surfaces, especially in restrooms and gas handles. RV travel tends to mean fewer stops for food and bathroom breaks, but it still will have some associated risk. So you can weigh how you want to travel to various locations based on your personal risk assessment and how much risk you're willing to take. Then you can protect yourself while traveling. We've all heard about social distancing of 6 feet. Respiratory viruses are transmitted by droplets of respiratory secretions that are expelled when we talk and laugh and cough and sneeze. And this is, and they are usually heavy and usually fall out of the air fairly quickly and in a radius of 6 feet. Now, this is, social distancing is more important indoors and in larger group settings with unknown persons than when you're in smaller group settings, and with family members or people who are known to you. And why I say that is because with the advent of contact tracing that has been going on with our public health departments, there is a lot of people know that whether or not they've been exposed to somebody that has come down with COVID. And so there is a lot more likelihood, if you know somebody, that you're going to have those conversations, that there's a potential risk or not with those people, as compared to people that you do not know. Appropriate use of mask. The ideal masks that you need to use are either surgical masks, if you can obtain them, or 2 layers of a washable, breathable cloth. And the 2 layers is important. And then finally, hand sanitation. Hand sanitation is always a good policy. We have, in healthcare, been talking about hand sanitation since 1848. And in my profession, I still talked a lot about hand washing. So it is something that we can always do more of. And then also the transmission of respiratory viruses and COVID via hands is because we get our hands dirty by touching something that somebody else maybe coughed or sneezed on, and then we touch it with our hands, and then people always are very commonly touch their mouths, their nose, and their eyes, often subconsciously. And so that is how you inoculate the virus to yourself, with your hands. The most common method of disease transmission is via the respiratory droplets, and the hands are much less common disease transmission. A note on masks, since we did talk about masks, they are a simple barrier to prevent respiratory droplets from an infected person traveling into the air and onto other persons. So masks are primarily to prevent the infected person from getting the virus into the air, as shown in this graphic. The concept behind what we call universal masking, where we're all asked to wear a mask when we're in the grocery store or when we're in a public building, is that we don't know who is the infected person. So if everyone is wearing an appropriate mask, then the virus is not getting in the air. Masks do reduce the spray of droplets when securely worn over the nose and mouth of the infected person. And the operative word here is securely worn. A mask cannot droop down where you can see somebody's mouth and nose. That's not accomplishing anything. And then the use is important in close settings where social distancing is really difficult to maintain. And that's mainly like when you're in stores shopping, there people are moving back and forth, and it's really, really impossible to maintain social distancing in those situations. There are ways not to wear a mask. And I find them all the time. Every time I'm in a store, I'll see somebody with one of these. The only one I have not yet seen is on your arm, but I've seen them around the neck, on the forehead, under the nose, on your nose, under your chin, and dangling from one ear. So it is important to have the mask right. And if we aren't all, back to the concept of universal masking, we all have to wear the mask correctly. And then what is not an appropriate mask? And this is important as well. So there are masks that have an exhalation valve or a vent, or I've even seen advertised masks with a cut in them so people can drink and eat while still wearing a mask, do not prevent the virus from escaping into the air. Especially the exhalation valves, they just they do nothing. They just allow all the air to come out into the environment. Masks that are used for makeup protection or food service are not appropriate. They are not doing any job. And then the CDC is evaluating the effectiveness of net gaiters. They are single cloth, and they may actually disperse more smaller droplets than be protective. So more to come on that. So they do not recommend net gaiters. And then there is a purpose for the face shield, and that it is not as protective, but for people that are communicating with people that are hearing impaired that need to lip read, there is a reason, there is a purpose for having a face shield at that point. Hand sanitation is an important concept, as I mentioned. You need to wash hands with soap and water for 20 seconds so that you get good agitation to pick up the dirt and the bacteria. If soap and water are not available, use hand sanitizer with at least 60% or greater isopropyl alcohol. Hand sanitizers kill bacteria and virus on your hands, and so they are really, really effective at cleansing your hands and sanitizing your hands. For either of these, soap and water or hand sanitizer, you need to make sure that all surfaces of the hands and the fingers are cleansed, and that includes between the webbing of your fingers and the fingertips, and the back of your hands as well. Gloves are not recommended except if you're caring for an ill individual, somebody that may or may be ill with COVID, and they are also recommended if you're ever dealing with somebody that maybe may have vomited or having diarrhea. So they are limited use. Why gloves are not recommended is that when you are wearing gloves, you're not likely to do hand hygiene, and so they have a inverse corollary on effectiveness. There are key times to wash your hands: before, during, and after food prep, before eating, of course, before and after caring for someone who is ill or treating a wound, after using the toilet or changing a diaper, after sneezing, coughing, or blowing a nose, after handling garbage or dirty laundry, and after handling pet or animal waste. And most of these are common sense, and they are things that not only we need to use for COVID and incorporate for COVID, but we need to use them for general daily life and keeping ourselves healthy. Now, here are some strategies for those that are hosting travelers. First of all, cleaning and disinfection are key components. Cleaning reduces the number of germs by removing dirt and other impurities, and disinfecting kills the germ on surfaces. So you need to do both. They are not equal, and they are compatible. They have to both happen in concert. It is important to focus when you're doing disinfection on high touch surfaces like light switches, doorknobs, toilet handles. You can disinfect electronics such as iPhones and remotes and iPads using 70% alcohol on a soft, clean cloth. And soft items you can launder.
Beth Ann, can I ask, so there have been some questions in the chat. Some I'm going to wait till later, but what about the temperature of the water that you're washing your hands in?
It just needs to be lukewarm.
Okay.
Something that's very, something that's very comfortable.
So you'll do the whole 20 seconds, right?
Right, so yes. And you'll rinse and you'll feel very comfortable. So you choose the temperature that's comfortable to you.
Okay. All right.
Any others?
Well, there was, but I think we can wait till we get to the end.
Okay.
All right, thanks.
Bleach, if you choose to use bleach as a disinfectant, there are some caveats with bleach. You need to make sure that it's a 5.25 to an 8.25% sodium hypochlorite solution. So you can read that on your bleach bottle, and if your bleach bottle doesn't tell you that, then don't use it. There are bleaches that don't have that percentage and do not serve as effective disinfectants. You need to ensure at least 1 minute of wet contact time on any surface being disinfected when you're using bleach. And you need to check that the bleach is not past its expiration date, and there'll be a mark on the bottle that will manufacturer will have put on there, giving that date. Never ever use bleach with ammonia because it creates toxic fumes, and bleach solutions are only effective for 24 hours after dilution. So, and then I give you the dilutions for the appropriate dilutions of 5 tablespoons in a gallon or 4 teaspoons in a quart of room temperature water. Laundry, you want to use the warmest appropriate setting for both washing and drying of the laundry. Do not ever shake dirty laundry, and always wash your hands immediately after handling dirty laundry. But using your home washer and dryer will effectively clean and disinfect any sheets or towels. Trash cans, it's recommended that you just use trash can liners so that it's easy to dispose of tissues and other items. And you always want to wash your hands immediately after collecting and disposing trash. And then finally, HVAC systems. There's several things that you can do with your HVAC system to improve the air quality and ventilation of your home. You can make sure that there is an HVAC filter in place and consider using the highest grade filter your system can accommodate. HVAC systems only filter air when the fan is running. So you can set the system to run fan even when it's not heating and cooling so that your air is going through that filter continuously. When used properly, air purifiers can reduce airborne contaminants, including viral particles. However, a caveat there, or a note, that ozone machines are not air purifiers and they are not recommended for this purpose. And then additional ways to improve ventilation is you can open windows and screen doors if possible, if the temperature allows, or you can operate bathroom fans continuously to pull air and exhaust air out of the home and increase ventilation. Now, there's been some discussion about Operation Warp Speed and vaccine development for a COVID vaccine. And so I wanted to dive into this a little bit. So what is Operation Warp Speed? Well, it sets a goal to produce a safe, effective vaccine for COVID-19 by January 2021. This endeavor is being led by Health and Human Services, which has the CDC, NIH, which is the National Institutes of Health, and the FDA under Health and Human Services, and the Department of Defense. And I think the Department of Defense is because they are experts in logistics and getting things done. So that is their collaboration. I have given you the website there for their fact sheet. Explains Operation Warp Speed in great detail, including timelines and expenditures. But the breakdown is that there are currently 3 vaccines in phase 3 trials under Operation Warp Speed. One is from Moderna, one is from Pfizer-BioNTech, and one is from AstraZeneca and the University of Oxford collaboration. Now, recently AstraZeneca was in the news because they did do a pause on their phase 3 trial because they had one patient that presented with myelitis of some sort. And so they did have a pause, a safety pause. That patient has been examined and reviewed, and they have reinstated the phase 3 trial since then. Phase 3 trials, what they do is they look at the proportion of cases between vaccinated and placebo-controlled patients, and they give our volunteers, and they give they do tens of thousands of volunteers within these phase 3 trials. Sorry, my phone's starting to talk. So there's tens of thousands of people already involved in these phase 3 trials. And the federal government has invested in the meantime, the federal government has invested in the necessary manufacturing and distribution capacity necessary to give vaccines. And so what has happened is, in order to shrink the time frame, is that instead of developing a vaccine and then saying, oh, look, it works, and then saying, we're going to manufacture it and market it and find capacity for it and then distribute it in a linear sense, they have done the research and the testing simultaneously with increasing the manufacturing and distribution capacity. So for instance, manufacturers are creating the syringes and the needles and the vials, and and setting up the distribution chains at the same time. This has all been funded through $10 billion that was allotted through the CARES Act. What the leaders say, I did get some comments from, one is from the CMO, which is the Chief Medical Officer for Moderna. And what he said was that why this is able to be so fast is that we've had advancements in technology. So what we're doing would not have been possible 10 years ago, but technologies that have advanced to allow for a faster pace. So it took for Moderna, it only took 2 days from receiving the sequence of COVID, which was put online by China, to being able to start production in research. So they were immediately able to address and start looking at vaccine possibilities. And they were able also, he said, was that, historically, or 20 years ago, we could only look at one potential vaccine modality or vaccine possibility, but because of advancement of technologies, they could look at thousands simultaneously and pick out the ones that worked the best.
Beth Ann, while you're on this one, someone asked, do the different products all work the same, or do they all work differently? The different options or
vaccines?
Yes.
I do not know that. I have not been able to dig that out and parse that out yet.
Okay.
I don't know. I do know Moderna's is a RNA vaccine where they, but I don't know the other two, what their format is.
Okay.
The CEO of Pfizer today actually said that Pfizer's already manufactured hundreds of thousands of doses just in case they have a good phase 3 study and FDA approval. And so if the phase 3 data come out well and they have FDA approval, they say that they will have a good chance that they will know whether or not they have a effective vaccine by the end of October. So for me as a scientist, I find this very exciting. But also I have heard very well-meaning, intelligent, knowledgeable people say, I'm a little leery about how fast this is going. And so I wanted to do this deep dive, partly for myself, because I feel now, having done the research, that I will take the vaccine when it is available to me, and will encourage my family members to do the same. Recognizing that distribution of the vaccine will initially go to healthcare workers, to frontline responders, such as police officers and people who are in congregate settings, such as nursing homes and correctional facilities, because those people are higher risk, and then it will move down a risk strategy, probably since CDC has recognized there's some relationship for based on ethnicity, that they may try and strategize to get those those ethnic groups addressed earlier and in the risk stratification of distribution as well. So I will take the vaccine when it's available for my risk strategy group.
Beth Ann, another question from someone was, a lot of medications have side effects. Do vaccines, and how long after, so people are going to be taking this, is there generally a time frame that they do in studies for when you start seeing what side effects are, if there are any? Did I put that? right?
Historically and historically in vaccines, and I can only speak in generalities at this point, but historically in vaccines, a side effect is going to be almost immediate. There's not a long tail to a vaccine. The whole purpose of the vaccine is to stimulate the immune system to produce antibodies and recognize the virus. These vaccines do not contain actual virus. They are components of the virus. They're either a protein or a piece of RNA that are causing the body to then, a piece of RNA that will cause the body then to make the protein. So there is not an actual organism that's being injected, unlike other vaccines such as the flu vaccine, which has actual virus particles. So you will know if there's a side effect almost immediately. And vaccines, to my knowledge, I am not a clinician. I do have to put that caveat, but to my knowledge, a vaccine has not ever had a contraindication with a medication.
Thank you.
There are additional ways to minimize risk for yourself. One is, I'd like to say sunshine is a friend. Sunshine is actually a wonderful, wonderful disinfectant. And sunlight has been shown to kill COVID in minutes. So this is from Oxford University, a study that they did, and they found that 90% of viral particles are inactivated in 6.8 minutes in the summer and 14.3 minutes in the winter because of the solstice and the amount of the angle of the sun. And they used their data, they simulated 40 degrees latitude, which is Philadelphia. So anything south of Philadelphia, you're going to have that time frame is going to shorten. North of Philadelphia, it will probably increase a little bit, but 40 degrees was the latitude that they chose for this study. What it tells me is that, and it's something that I have known for years as a microbiologist, is that sunlight has been recognized to be a great disinfectant, and what it does, it binds viral and bacterial DNA and RNA, so it makes it impossible for a microbe to replicate. And so if they can't replicate, they can't infect you. And what I have historically done, because of just my background, I've always, when I've gone to the grocery store, I always pick the grocery cart that's in the parking lot in the sunshine, because it's been disinfected by the sunlight. And so that's the one I always pick, and then I wheel it indoors. And also it's a great place to put my purse so I don't have to carry it, and many other options there. But at the same time, it tells me that walking and biking outdoors is really safe without a mask when you know that you can easily maintain social distance. So if you're just walking and strolling yourself and you're passing by, and all you're doing is passing by people, you have no contact time with them. You just, you have seconds, less than a second generally when you're walking or passing them. Then you can safely go about your life walking and biking outdoors without a mask. The other, this was a fascinating study I found, and it caused a change for my husband and I in our own personal life, is that, and this was from September 3rd, and it's out of the University of Chicago. And they found that they went back and looked at 489 patients that had their vitamin D levels measured in the last 12 months. And then they looked at the patients to see whether or not they had had a positive COVID test or not. And they found that patients that had deficient vitamin D status were 1.77 times more likely to have a positive COVID response than those with sufficient vitamin D status. And this was a statistically significant result. And so I read this article, I was fascinated by it, did a little look into what they said about vitamin D. Vitamin D is called the sunshine vitamin. It is the one vitamin that we make as humans on our own, and we make it from sun exposure on our skin. That's sun exposure on our skin without sunscreen. Vitamin D helps the absorption of zinc, And zinc has been shown to decrease the replication of viral RNA. And this is actually studies that were done prior to COVID. So it's been known for quite some time that zinc has that effect. Vitamin D also improves the function of T cells and it just increases our general immune response to make it more robust in general. And then higher vitamin D levels correlate with lower interleukin-6 levels. Interleukin-6 is a component of severe inflammation and the cytokine storm, which is associated with severe COVID-19 response. So the higher your vitamin D, the lower your interleukin-6, the less likely you're going to have a severe inflammatory response. So just on a personal note, my husband and I looked at this data, or I had my husband look at this data, maybe I should say that. And we know that we are outside all the time and we get a lot of sun exposure. And so we're not too worried about our own personal vitamin D levels, but I would recommend for anybody that is questioning that they could discuss it with their physician to see if that's something that they could have examined. It's just a blood test to find out. But the one thing we did do was we were uncertain how much zinc we got. Zinc comes from oysters, we learned, is your best source of zinc. And since we're not eating oysters all the time in Boise, that we decided to start taking a multivitamin to get a little extra zinc in our diet. So we figured if it's likely to decrease our chances of getting COVID by 2, I'm good. And then finally, take your annual influenza vaccine. It is already available. And remember that it takes 2 weeks for you to actually develop immunity after you get a vaccine. And it takes that long for your immune system to gear up and create the right components to create sufficient immunity. So I am very much an advocate of getting a influenza vaccine earlier in the season as opposed to later, and have actually already gotten ours. Now, the fascinating thing about influenza in the age of COVID-19 is that, and this is from the World Health Organization from August 28, is that we don't have circulating influenza virus. So this is for the Northern Hemisphere. And if you notice that the virus it really peters out about week 16 of 2020, which is basically the end of April. And that's, it just basically went away in the Northern Hemisphere. That's about the same time we all were shut down and not visiting, and so that kind of makes sense. And also flu is seasonal and it's a winter virus. The interesting thing though is that the same thing occurred in the Southern Hemisphere, and they have had very unappreciable rate transmission of influenza virus in the Southern Hemisphere as of mid-May. And so there's right now not any appreciable influenza virus circulating that that can be identified. So I'm, from a scientific standpoint, interested to see what our flu season actually looks like this year, but I still recommend getting the influenza vaccine. And with that, I thank you for your time. I'm open to questions.
We do have a lot of questions. And I'm
Kathleen,
yes.
Kathleen, it'd be best if you asked them, and so we could stay on track and get through them.
Okay, and then if you, yeah, all right. I'm gonna start. Let's see. Oh, here's someone who has a gator. They wear the gaiters. They put coffee filters inside their gaiters and thought that gave them the 2 levels. Let's go to speaker view. So, is that a safe thing?
That is in looking at it from risk stratification. That is a definitely decreases the risk of transmission. So
Very creative.
Yeah, it's very creative, and it is definitely a step in the right direction.
Okay. Then we had Dorothy Johnson. She said, my granddaughter's friend and all the girls on her floor got COVID, and they must be in college, and quarantined together. So are they all set as they think they are? I thought you can get it more than one time.
My understanding is that once you get it, you should be immune. They don't know how long immunity will last, but it will last longer than 6 months. So, we're already only 6 months into it. I have heard of a single case where they actually identified that a person got it twice. We are dealing with a novel virus that is still kind of settling into what it's going to be and its strain type. And so viruses, as they replicate, do mutate fairly rapidly. So it is possible that we could get a different strain that could cause somebody to get it again. So there's a whole lot we still don't know on that, but they should be immune and should not be at risk of getting it again.
Well, and there's a follow-up by Dorothy. You must be this same granddaughter. What is your thought of students being required to wear masks during cross-country or soccer meets, as sometimes required in our state? You kind of addressed that.
Yeah, I know different states have different rules, and so I don't want to, it's a lot of, having dealt with public health departments and bureaucracies for 20 years, there's some of we have to do something and we have to show we're doing something, so therefore here is a rule. There's not a lot of science behind masking people that are trying to run. I don't know how you can do a good cross-country match with a mask on, or playing soccer, but I can't, but at the same time, I can't counteract the rules. But so I know that I probably would not do it. I can say it that way.
And these are, it sounds like college kids, high school or college. So.
And as you saw from the CDC data, they're so much less likely to, college, the young teenagers are so much less likely to be hospitalized or be severely ill. And those that do, and we periodically hear about them, do have comorbidities associated. So again, you have to go back to those comorbidities and look at your whole risk spectrum to identify what you're going to do and how you're going to approach things.
Okay, thank you. So when you were talking about doing the laundry, this question came up, what about pillows? Do you, you wash the sheets and towels, but can you just put a clean pillowcase on the pillow?
Yeah.
Okay.
That's the purpose of a pillowcase is what we call creating a barrier, and so it would effectively keep the pillow clean. Most pillows do. There are pillows that have an extra casing that you can actually pull the fiberfill out and wash the casing as well. So you may look at your pillow or invest in those types of pillows.
Well, and I guess if you're traveling by car and like staying with Evergreen members, you might want to bring your own pillow if it's, you're used to it. I mean,
Exactly. I mean, I know that, I know people that do travel with their pillows because they sleep better with their pillow.
Yes. Okay. Here's one from Jeanette in New Jersey. Is it safe to eat out as far as food prep is concerned?
Yes. There is not any evidence that COVID is transmitted by food. Appropriately cooked and served food in standard food hygiene practices. There should not be any risk there.
And she followed up with, do we need to sanitize all food containers and the plastic bags from the store?
No, actually that has been debunked. And actually there's a little more risk to trying to sanitize food containers because you may contaminate your food with sanitizer, which is ill. It's interesting, the actual bags from the store, it was prior to COVID-19 that there were some studies that we got into reusing bags and having our own totes and stuff for groceries in order to be conservative and conserve plastics and be good stewards of the environment. But if you don't appropriately clean those totes on a regular basis, they can be contaminated with potentially meat juices that could then cause salmonella or shigella. And those sort of studies were already there, and that kind of got translated into grocery bags cause illness. Well, it's dirty reusable totes can have chicken juice on them and cause you to have salmonella or shigella. So it kind of got conflated in the whole discussion.
Okay. Let's see, from Stan and Sandra, do each of the vaccine, I asked you that one, if they work differently. And you answered it. Do you believe the 6 feet distance rule is sufficient distance, or should it be further?
I think it's sufficient distance. I have no evidence or knowledge to counteract that it would need to be further. I think it's quite functional.
Okay. In the past, how long after a vaccine was approved? Oh, I already asked you that one too. It was about the side effects.
Oh, okay.
And you said that would happen really quickly. How long can COVID virus stay in the air? If I follow someone with COVID, is it likely that I can get COVID?
So it will stay in the air for a short period of time, and it depends on, are you outside, are you inside, or what's the air ventilation, the air circulation. So there's a lot of components in there, but there's also, and if you let me go back to an earlier, if you go, and I'll see if I can share my screen again, because the CDC points this out, that let me find to share screen, hang on, that you have to have duration of exposure also. And so let me show you this one here from the CDC, is that you have to have, when you're exposed, you have to have a duration of exposure. So just passing somebody on the street, passing them while you're walking past them and it takes just a couple of seconds, you have to be able to breathe in sufficient number of viral particles to cause infection. And coronavirus doesn't occur with just one viral particle. I can't tell you how many it takes, but it's more than one. And so you have to have a concentrated inoculum to breathe in, to get onto your mucous membranes to cause infection. And so, depends on your circumstances, but it's an infectious virus. It's more infectious than flu, but it's not wild. It's not crazy infectious that it's, flying through the sky.
Okay. And I don't know, I didn't tell you, Beth Ann, that you actually can move your cursor over the PowerPoints. If you had something you wanted to point out to us.
Oh, okay.
At least I think you can. Yeah. And I
Can you
had
see
that
it now?
covered up by a picture panel, but
Okay.
okay,
Yeah.
great. All right.
But these are the factors that increase your community spread. How many people are there, how close you are in contact, how enclosed the space is, you know, against air circulation, and the duration of exposure time. I will say that while I was working on the duration of exposure time, while I was working in Seattle, working with healthcare workers that had come, that had been exposed to somebody with COVID, we used the exposure time of 15 minutes.
Okay. Let me pull up the chat again, see where I was.
Yeah, Beth Ann, could you show the next slide?
Yes. This one?
It didn't change for us.
Oh,
Didn't change.
okay. This one.
No. Why don't you go up to where you share the whole screen? Oh, here we go. Oh, there we
Okay.
go. Okay.
Thank you. That was the one I wanted to see.
And I will share these with Kathleen if so she can send them out to the group.
Yeah, they'll be on the blog for sure. Are you seeing what you need in that, or do you need another minute?
I took a screenshot of it, so
Oh,
I'm good.
perfect. Perfect. Okay. Oh, here's a question. How long do the vaccines last in your system?
That's still an unknown. We have vaccines that last our entire life. Measles, mumps, rubella, polio are good examples of that. We have vaccines that we have to have every 10 years, tetanus. We have to have flu vaccine every year, but that's mostly because the strains change every year. You know, that part's unknown for COVID.
Okay. Let's see. How soon after the vaccination is given might the receiver be protected? Immediately, days, or weeks?
Generally takes 2 weeks for the body to mount an immune response after a vaccination. So you can still be at risk of getting infected for that 2-week period.
Okay. How much time in the sun is recommended for vitamin D? I try to limit time in the sun because there's skin cancer in my family.
That I don't know. I would have to look that one up. But it's kind of a continual effect. So it's not time in the sun. It's more constancy in the sun. So taking a walk every day, or spending, you know, doing a little gardening every day, or but it's more of a constancy effect instead of just a, you know, having 60 minutes of sun time every week.
Okay. Let's see. I think you might have touched on this. For how long is the flu vaccine effective? 4 months, 6 months, 8 months, or whatever?
Flu vaccine is really the reason we have to take flu vaccine every year is because the strains change every year. There are generally 4 strains circulating each year. They mix and match every year. They change every year, and so some will stay 2 or 3 years, but another one will, of the 4, another one will be completely different. And so that is why we have to have the flu vaccine every year. The vaccine immunity for flu vaccines generally last about a year, but they can wane depending on immune system ability.
Okay.
Just
Go
a
ahead.
quick, I was going
Uh-huh.
to say, just a quick note on vitamin D is that in my looking into that, actually, it is, they estimate that half of the population of the US is insufficient or has deficiency in vitamin D. Most likely, those that live in northern climates that don't get as much sun or as long of days of sunshine. And, if for instance, if you're in Chicago and you work from 8 to 5, you're not seeing the sun for about 4 or 5 months of the year, same in Seattle. So those people are at the higher risk of vitamin D deficiency. So, and like I said, it's, if you have questions or concerns about your vitamin D status, it is a blood test, and you could talk to your physician about that. It's easy. Vitamin D deficiency is easy to treat. You can take vitamin D supplements that are safe and effective. So, but again, it would be a discussion with your physician.
Thank you. We have almost out of time. So here's one last, it says, where can I find the map you showed us of the COVID situation in various states? And I guess I can answer that, how it's going to be on the blog post. You'll be able to click on it and get to the link. Is that not correct, Beth Ann?
Correct. The link is embedded in the slides.
Okay. Okay. And there was one last question, and I'm not sure I actually understand what it says. It is my understanding that the antibody level decreases rapidly post-vaccination and may not be detectable after 3 months. Other tests for protection are T cell levels, but this test is difficult and expensive. Paul, if you need to say anything else about that, unmute yourself.
So I understand the question.
Oh, okay.
So in immunology, whenever a human or an individual has a challenge from or an infection or a vaccine from a virus or bacteria, the body is stimulated to mount an immune response, and create T cells and B cells and antibodies. But in reaction to the infection and to the virus, antibodies, because they're not needed immediately, antibody levels will wane over time and go down over time. But your B cell memory is still there. So when the actual virus comes, your B cell still remembers having seen it, and the T cells still remember having seen it and react to that virus. And so there is not the 2-week time lag to create antibodies. They can immediately create antibodies in order to neutralize it. So so that's not uncommon for antibody levels to diminish over time after a vaccination.
Okay. Do you want to stop the screen share so we can see you again? Okay. There we go. And that got through all the questions, and it is...
Excuse me, you missed my question.
Oh, I'm sorry.
I want to know what type of air purifier one could buy to keep at least one room in the house purified.
I don't know brand names. I would recommend a air purifier that has a HEPA filter associated with it. HEPA filters, pull out 99% of particles and to small sizes. So that would be where I would start, was looking at one that had a HEPA filter in it.
Thank you very much. It's been a great presentation.
Well, thank you.
Oh, good. So there's one other. Dorothy she missed the introduction and wanted to know who you worked for. And if you want to field that.
Okay. How far back? So, I have been an infection preventionist for 3 large hospital systems, 2 in San Antonio, Texas, and 1 in Seattle. For 2 of them, I was their director for infection prevention and employee health for the hospital system. So some of these involved 5 hospitals, some involved hundreds of clinics, and so that's kind of my history, I guess, if that helps.
And right now, Beth Ann's doing consulting
Mm-hmm.
between being retired and having fun in Idaho.
Looks like I get to go
Very
work in New
much.
Jersey next.
Thank you very much, Beth. That was very, very good. Should I
Thank
ask
you.
my question, Kathleen? My last one, which was, Beth, since the word micro
Oh,
implies small,
We need to wrap it.
how tall could you be and still be considered a microbiologist?
Anything you can't see with your eyes, you have to use a microscope.
oh, well,
And that was great. That was wonderful. Thank you so
Thank
much.
you. I enjoyed it.
really-
Thank you.
It was really informative, and I think everyone feels like, okay, we've got a better handle on this. So thank you.
Feel safer now.
well, and so I think it just kind of gets down to if you have a trip and you want to travel, just really communicate, find out what the host preferences are and what yours are. And is that safe to say? And then everybody just decides for themselves.
I agree.
All right. All right. Well, thank you again, Beth Ann. This has just been wonderful. And I'm glad everybody joined. And I have no idea what the program will be next week. But we'll have something fun. And so I hope to see you all again.
Okay.
And I know some of you have to dash, so I will say goodbye. Thank you.
Bye-bye.
Thank
Bye-bye.
you all.
She looked like Fred's wife, Judy. Yeah, looked a little bit like. Yeah, we can leave.
I have a quick question. Was that recorded? Do you
Um,
record any of these?
I do, and I missed the first couple slides, but all of it will be turned into a blog.
Okay,
Oh, but you're right. You know what? All of what Beth Ann said won't be there.
be out there.
But
Because
so,
that was outstanding.
Yes, it
Aw.
was.
It was outstanding.
well,
And I tuned in late
oh,
because I had stuff here I had to do.
sure.
But I would love to see it recorded. It would have been wonderful to be on ours for everyone to see, all the members.
Well, you know what? We have been saying we should see if we can make the blog video as well as just written, and this might just be the motivation we
Because
have.
she was outstanding.
She is good.
She really was good. I learned a lot.
Oh,
So
good.
thank you so
Good.
much.
You're
Okay.
welcome. All right. Nice
Bye-bye.
to see you, Charlene. Bye.
Bye-bye.
All right. Was Sandra there tonight? Stan, I couldn't see with the screen share. Has Sandra been back and forth?
Another Zoom.
What's the
so-
question?
Oh, there she is. Okay.
We have another Zoom.
We have
so
another
gotta get
Zoom
off.
starting now.
Okay, we'll see you later. Bye. Oh, goodness.
Bye-bye, thank you.
Thanks so much.
Yep.
All righty. Bye-bye.
Bye.